healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. This is a super special episode. We're joined by our very own, the Alicia Brown. She's here to talk to us about virtual nursing, what it is, the barriers and facilitators for adoption, the latest in research and practice, her personal experience, how it benefits patients and different healthcare entities, the upcoming event that she'll be attending, and what she'll be talking about when she's there. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a co-host here at the Melanin Initiative, along with Alicia and Geraldine. Geraldine sends her love in her absence. We are a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it to manage your health and advocate for others. It's our hope that by watching on YouTube or listening on your favorite podcast app, that you'll feel empowered to ask questions, educated on how you can manage your health, and confident to navigate the healthcare system. If you haven't already, please subscribe, give us a thumbs up, depending on which platform you're watching, follow, like, share, all the things. It really helps the algorithm know that this information is important, so that when people like you look for topics like this, we'll show up higher in the search results. As a friendly reminder, remember, this show is for educational purposes only. The opinions expressed here are opinions alone. They're not a representation of any of our affiliations. If you think you might be experiencing a medical emergency, you should call your healthcare provider. If you think you're having a physical emergency, you should call 911. If you're having a mental health emergency, you can call 988 or text 741-741. Alicia, welcome to the Melanin Initiative.
Hi, Kimberly. Thank you for having me.
This is such a special show, a really special one for me personally, because I've known Alicia since she was a baby nurse. I used to be her preceptor, and it's been a blessing over the years to watch her flourish, not only into a woman, but also to see her professional development. And she's entered a really wonderful space, not only for her own fulfillment, but for the healthcare system, which we're really excited to learn about. And more importantly, which I'm super thrilled about, she's stepping outside of the system and letting her voice be known and building her own brand. And so this is kind of the beginning of that. And it's all because of this upcoming event she has. And so there's an opportunity for us to showcase her knowledge and expertise, but also to promote what it means to be part of a professional organization, the benefits, and most importantly, how you can contribute to that if you're in healthcare to advance our profession and our practice. So how are you doing?
I'm doing great. It's been a good week, so I'm excited to be here.
And we're excited to have you. I will let, just a disclaimer, everyone. I'm actually in Detroit. What up, though? To our friend Demetrius. I came up here to visit my goddaughter and our extended family, and my puppy's here. This is where I adopted him. So his whole family's here. When I say his whole family, his mom, his dad, his sister, his brother, and there's a baby. So there might be noise. There might be noises in the background. Just to give you a heads up. You're used to the puppy being in the background, making all his puppy noises. You can multiply that by 5.
Oh my goodness.
So let's get into it. If you can, just for the people who don't know, and this might be their very first time watching the episode, give us a little bit about where you're from and who you grew up with in your home.
So I'm Alicia. I grew up in Virginia, Northern Virginia, really. I went to get my bachelor's degree at George Mason University, and then started as a new to practice nurse in DC in 2015, and then moved into leadership in 2021, and I have been there ever since. I'm very active outside of my job. I am in a sorority, Sigma Gamma Rho Sorority Incorporated. And I love hanging out with my friends and sleeping and eating and all the things. So that's a little bit about me.
Except if those things include being outdoors, water, bugs, nature.
I'm working on the water. I am working on the water. Me and nature still are not friends.
Well, stay tuned, folks. That might change. So I love, what we do, as you know, we like to do 2 things here with this show. We like to promote health literacy, right? To give people language but we also like to promote and elevate the voice of nurses and all the opportunities in the industry. And so I love that you are a nurse and you have gone into leadership, because so many times when people think they need to advance their education, that the only option is being an NP, which
Right.
is wonderful profession. Don't get me wrong. I love it. It's just not the only option, and it might not be the best one for you. And so because I do have a little bit of a background on how you kind of ended up kind of got in that direction, can you just share a little bit about outside of the bedside, what you were doing in the hospital before this leadership, kind of like your involvement at the practice council?
Right. So, at the bedside, I was serving as a preceptor. So I loved teaching the incoming new to practice nurses. And I also was a charge nurse. So, helping to run the floor and things like that. But I also was really involved in our hospital practice council. So the responsibility of the hospital practice council is to look at and edit all of the policies that we use on the nursing side. And we literally read them line by line. You get assigned a policy, you look at the evidence, and you make sure that what we're actually doing is reflective of the policy. Because it doesn't make any sense to have a policy and we're not actually doing what the policy says. So I did that for quite a while. Then I also became the lead of that council. And then precepting and
What
teaching.
does that mean? What does that mean?
Oh, the lead. So I led the meeting. I came up with the agenda, what we talked about, and then actually physically was the head of the council. So
And you got to meet a lot of people, right?
yes, that's how I would say you get tapped in to interacting with leadership in the hospital, is by being a council lead, because anything that happens in that hospital, they really want practice council's involvement, because they want to make sure the nurses, the bedside nurses, are involved and have an opinion on any change. So it could be the VP of nursing reaching out, asking if they can come on the agenda for the meeting to discuss a new project or process they have coming up. It could be the CNO, the chief nursing officer, coming to you and asking. She may not come to the meeting, but she may give something to you to present at the meeting, and then you have to get back to her. So there's different ways that you interact with folks, and it's definitely a way to meet not only leadership but other nurses across the hospital. Oh my gosh, the people I met that I still have relationships with now, and actually are kind of important when you talk about things like virtual nursing and you need buy-in. Those relationships matter. And I don't think I realized that until I got into leadership, how much relationships matter, but they do.
So the guys who are our blueprint, the Earn Your Leisure guys, Troy and Rashad, they always talk about the business of relationships and how that really has an impact on what you're trying to do. So a little bit before Alicia came on, I had been at that healthcare system, which is a magnet facility. Do you happen to know the numbers?
What years we
Like
got,
how
Mike?
many there are? Because isn't it only like, I
Oh, well, I don't know how many, but I can tell you now, the organization that we're talking about just received their fifth, and there's only about 50 organizations that have
oh,
ever
there it is.
received their fifth.
I know they keep
So
track of
it's
that.
a
Yeah.
limited number.
Yeah, so there's only 50 that that are magnet. Do you want to explain what magnet even means?
Um, Basically, Magna is nursing excellence. So they designate this for hospitals that are top in nursing research, nurse-driven protocols, nurse-driven outcomes, which are things like we have central line infections that we monitor. We have hospital acquired pressure injuries that we monitor. Whenever we insert those Foley catheters and you don't get an infection, we look at that. And then we make sure our patients don't fall. So they look at those things, and those are all indicators of nursing care. So they want to make when Magnet comes in, they look at your numbers. They go to each unit. They talk to the nurses, not the leaders, the nurses, to see if they know what projects are happening on their unit in their hospital and what they've contributed to those projects. And the hospitals that rise to the occasion receive Magnet.
Yeah, and what's really nice is that nurses have a voice at the table, right?
Right.
Isn't that shared governance?
Shared governance, and those councils that I just mentioned, having a council. Not all hospitals have that structure in those councils for the bedside nurses to have a voice. So that's a big thing that Magnet looks for.
Yeah, and so when you're learning in a facility like that, it helps you expand that perception of being just a nurse, right? You
Right.
know you're not just a nurse and that your future can go beyond the bedside. And I would say the culture there is really, and it's controversial, but typically you get your 2 years of experience and then that you're encouraged to continue to pursue your education in whatever way you want. But that's kind of the culture. Like we know that this is the beginning, but it's also not the end.
Right. And interesting, a couple of other things I did while I was bedside. I was a nurse residency program facilitator.
Mm.
So the facility that we worked at together has a nurse residency program. Highly recommend if you are new to practice nurse to find a hospital with a nurse residency program. It really guides you in and makes you feel like you're not alone. And for me, that was the number one thing. You know, all new to practice nurses kind of go through the same wave of feelings and experiences. And it's nice to know that you're not alone. So I was a facilitator for that for a little while. And then I think one of the most important things I did there was a clinical advancement project. And that kind of takes you from, there's different levels of nurses, like novice, expert, all the things in between. But our particular institution had clinical nurse 1, 2, 3, and 4. And these projects take you through those ranks. So I developed an acuity tool because one of the complaints or challenges on our particular unit was that our shift assignments were not made fairly and they were just made geographically, which, as you can imagine, there could be a nurse that had patients who were very independent and didn't need much help versus some that had assignments that were very heavy and then the patients needed a lot of help. So I developed an acuity tool to kind of help balance out those assignments based on the patient's needs, and did some evidence before and after, and it actually helped nursing satisfaction. So there are things that you can do as a bedside nurse that you do not need, that doesn't come from the top down. It comes from your colleagues to help improve patient care. And I think that spirit of innovation has always been with me.
And I love it because in school, all of our focus is on how to improve the patient satisfaction, right? But in terms of a nurse or employee, that really comes from your clinical, whatever setting you're in, your experience is going to come from there. And whoever has an idea and thinks it should be implemented, who's implementing the idea? The nurse, right?
Mm-hmm.
And so this is a wonderful opportunity. And not all hospitals have practice councils,
Right.
which is kind of sad, right? But it gives us a chance to say, here's a problem. We found a solution that's worked in the evidence. We're going to implement it, come back in a week or 2 or 3 months, see how it worked. If it works, we keep doing it. If some things need to be tweaked, we tweak it. And
Exactly.
so it does increase your satisfaction. It increases retention. It keeps you around if you see that your voice makes a difference, because we know that, there can be some burnout. You see the same things day after day. You can feel a little bit frustrated. And so it's wonderful. And so I will back up a little bit. So shout out to our friend Sandra, who recently
Yeah.
got promoted to assistant director of nursing somewhere out there in the DMV area. She dragged me into to be a diabetes champion, right? So that was my first opportunity to be outside of the bedside. And then from there, I used to ask a lot of questions, hence this interview, right? All these interviews. And our educator and manager at the time were like, hey, you should bring back our practice council. Didn't know what that was. But it basically was what Alicia said. So instead of doing it for the whole hospital, we do it for our unit. What do we like? What don't we like? What should we add? Things like morale committee, CNA of the year. That was one of my favorites. The
Yes.
scheduling, right? Because before that, like you said, so when she says geography, it's kind of like if you have 20 rooms, 1 through 20, and you just do it like, okay, this nurse will take the first 5, the next nurse will take, the next 5, and so on.
Yeah.
If those patients are grouped in such a way that the sickest patients are up front, but the easiest patients are in the back, that nurse in the back or in the front is having a hard time. So instead of looking at as location of the patient, you look at it as how sick are they, how much time do they require, how much monitoring do they need. And that was actually, she's kind of, it was a big deal because there are a lot of senior staff on that unit who had put that in place and loved it. It worked very well for them because they had so many relationships. So whoever was in charge making that schedule was their friend, and they were putting them in the places that worked really great for their friend. But those new nurses were getting those really heavy assignments for the learning experience.
Right.
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 And it just was about someone just raising their hand and saying, hey, can we do something about this? And so we resumed the practice council. Shout out to Dr. Laura. Marcinkowski out
Yes,
in
yes.
Boston.
Mhm.
We were both co-chairs for that council, and then you needed one of those people to be the represent the unit at the hospital practice council. I chose to do that, which I loved because, like she said, you're actually opening up a Word document. You're changing the text. So if you want to see what comes out of your head happen at the with the patient, it doesn't get any more granular than that. And that
Yeah,
was to me, that was like, whoa. And then all the different people who email you to come to the meeting, I found out all these people who exist in healthcare, which is what we're trying to do with this platform. Tell you about all these people who make a difference. They don't wear scrubs, they don't touch blood, they don't touch
right,
patients. Maybe they're not even, because a lot of people say, I don't like people.
right,
They don't have to, they might talk to colleagues, but maybe not as much. So
right.
there's so many options. And then when I went back to grad school, it was too much for me to handle all those things. I looked at just like this show, I looked at all my colleagues to see who would be interested. And Alicia rose her hand. And I didn't think she was going to say yes. And she, because it's extra, it's work outside of your, out of your, what you're doing with the patient. So your manager does have to be on board and your schedule does get adjusted. So she took that, and then you had the opportunity to be interim manager.
I did. I did. So our leader had to be out for a little while, and she asked me if I would cover for her, um, not in an official capacity, but an unofficial official capacity while she was gone. I think she was gone for 3 months or so. So I stepped in. And I decided to try this out because at that point in my career, I was trying to figure out what was next. So I was like, hey, maybe let's just try this out and see how it goes, and I absolutely loved it. So that set the stage for the rest of my life so far, really. And I decided to go back and get my master's degree in leadership. And then I think this also set me up and kind of opened the door for ushering me into the position I'm in. And remember, we talked about those relationships. I ended up developing a relationship with my boss's boss when she was out because we had to work closely together. So she told me when that opportunity opened up about the new position they were developing, a new unit. And she told me, you should really consider applying because you did really well when you covered for our manager. And that's what I did. And then I got the job. So relationships. If I would not have known about that position if she wouldn't have single-handedly told me about it. So it
I
was really
love it. And you talked about the different levels of nursing, clinical nurse one, two, three, right? And
mhm.
so even with that, as well as with the project you did, the acuity tool, which I did benefit from, thank you so much. You
You're welcome.
got the pay goes up
The
because
pay
so
goes.
often nurses think the only way to get more money is to work shift after shift, but working multiple shifts doesn't add anything to your resume or your experience or your perspective. All these things Alicia just brought up are additional points on her resume CV that she can now add and talk about. And look how it expanded her and opened up her opportunities. So this is all for my young or older nurses who think there's only one thing, one way, be an MP or keep working multiple shifts. Those are not your only options. And Alicia's a beautiful example of that.
Thank
So
you.
then you went on to grad school.
Went on to grad school. And then the pandemic hit. And I was like, I don't know if I can do this bedside thing anymore. But like I said, I had developed that relationship with our boss's boss. And when the position opened up, I applied, I got into the position, and I've been here ever since.
And what was your master's in?
My master's is in nursing with the concentration in health services, leadership, and management.
Okay. And then you had to write a paper at the, didn't you do like a whatever that thing's called at the end?
A practicum?
Yeah.
Yeah, well, I had got the job, so my practicum was basically me being a new manager. I made it work for me. So yeah.
Wonderful. And then you got on board, and one of our good friends who had just taken a similar position for her master's, she created that like management
Leader
mentorship
checklist.
thing, right? You want to
Mhm.
talk about that?
Actually, I ended up using that as my like orientation checklist to make sure that I knew all the things I needed to know to have a job. Interestingly enough, that same person we're talking about was my preceptor in my master's program. So I had a preceptor at my job who taught me how to do my intricate day-to-day stuff. But then you also have a preceptor when you have a senior practic or a practicum for your school. So two of my trusted colleagues were my mentors as a new leader, and we utilized the checklist that she made to
In her
orient
master's program.
in her master's program, um, to make sure I knew all the things that I need to know. So once again, it just highlights the importance of, I would say, working for a facility, one that really takes your ideas, they believe in you, and they implement your ideas. And we still utilize that checklist today for all new leaders. So this is not something that just happened for her project, but sometimes that happens. People will use it for the time and then kind of let it go, but we still utilize that checklist. So it was very important and very valuable.
That's beautiful. And I love that you were able to share all these different, this is very valuable information for students or people in practice, because if you do spend so much time at the bedside picking up shift after shift, you literally have no time to look up anything else or learn anything else. And so thank you. And also the preceptor concept, thinking it's only for clinical routes, but you actually need preceptor regardless.
Exactly. Mm-hmm.
Thank you. Okay, let's get into virtual nursing. What is it?
So virtual nursing is a space where registered nurses can provide either support to nursing or patients from a remote setting. So they're not. Some are located in the hospital, but in an office space, and then some nurses are located literally from home. So they're just not at the bedside physically taking care of patients, but they're still providing care and education.
Do you want to give some examples?
Sure. So, some of the things that a virtual nurse can do to help support nurses, they can do admission databases, they can do discharge education, and that also benefits the patient. They can do education on medications, on different procedures that take place, MRIs, CAT scans, ultrasounds, x rays. Think about all the things that patients go through, but we don't have time to explain to them what's getting ready to happen. Different procedures. They can do appointment scheduling. We kind of talked about previously how there are certain metrics or quality measures that nurses are held to. So these nurses can do some chart audits to make sure that these metrics are being in place. They can help support nursing by doing skin checks together on a camera. There's certain high risk medications that maybe two nurses need to be a part of. So instead of that nurse running around looking for a second nurse, they just find that virtual nurse and they're in that room to do that blood check with them, that medication check with them. There's also virtual nurses out there that are scribing or physically doing the assessment in the computer as the nurse is doing the physical assessment on the patient. So taking away that documentation burden.
Mm.
For the patient, having access to a nurse when you want them just to ask questions is such a benefit. Because right now, you have to wait for that nurse to be available. And when they get to you, you may forget the questions that you have. You only can think of one. And then, you want to hit the call bell again, but it took the nurse 30 more minutes to come back. And by that time, you don't forgot the question, but all you want was some ice, so there's always a nurse available to answer your questions and educate and provide support.
That's wonderful. One of my travel assignments, they utilize virtual nursing. I want to say it was like a virtual ICU, and
Mm-hmm.
so putting in your numbers for vitals and maybe it flags or even blood work. So then they might call me and say, "Hey, so and so, I noticed such and such. Do you want us to keep an eye on them?" And of course, I say yes. So they bring in a vital machine that gets connected to their computer system, and then they're monitoring the patient. Whereas before, I physically couldn't leave the room when I
Right.
have 5 other patients, whatever you're working at, whatever the number is. One of those patients might be at risk for falling. Someone might have just come out of surgery. Someone might be dying. And, they all need you desperately, but so
Right.
does this person that's really in an acute situation. So it's really a fabulous intervention. So what have you found to be barriers or facilitators for adoption?
So when we were developing the program, we looked at it in 4 different aspects. We looked at it from a people perspective, a process, technology, and productivity. So all of those have their areas of success, but they also provide barriers. So one, staffing. Who's going to do the virtual nursing? Um, there's also a financial aspect and getting buy-in from senior leadership to support the advancements in that technology. And then I'd say the third thing is staff buy-in. Nurses traditionally are very independent and want to do
Mhm.
the work themselves. So it is a culture shift to say, hey, I'm going to give this away to a colleague and to trust that they're going to do it, and they're going to do it in the manner in which you would do it. So those are the three barriers: the staffing, making sure we have enough resources, the financial piece of it, whether that's the technology, how we're going to pay the people, all those things, and then the trust, that's the buy-in, from the nurses who actually want to utilize the technology.
And what's been helpful in getting these things implemented?
I think for me, from a financial perspective, I had to come up with a budget neutral plan.
Mm.
And it was difficult. So, from the staffing perspective, I had to, there's always budgets and, things like that. But I had to find a way to hire in these nurses, but not create any new positions. So, basically I use an existing cost center, which is every unit has its own cost center. So we ended up using an existing cost center with vacant positions and just filled those positions with virtual nurses. So therefore the unit had already had budgeted numbers and we weren't using them because there is a
Mm.
international nursing shortage. So there were nursing positions that we weren't able to fill. So I just asked my superiors, is it okay if we use some of these vacant positions that we know we're not going to fill this particular year, and let's fill them with virtual nurses? So that way, we're not asking for additional people. We're just using what we already have. And they approved that. So you got to find a way to speak the language of those who the people that are holding the purse change. You got to speak their language, right? And that takes some time and understanding of like, what are they looking for? So I understood that. So I was like, okay, got that. Check that off the box. So I found out how I was going to get my staffing. From a technology piece, the institution that I work for has an innovation center. So I got connected with the innovation center, and while working with them, they actually were able to provide me some of the resources that we needed. Um, and that is, I will say, solely based off of my relationships with those individuals. So I can't say that everybody would get that resource, but because of kind of
Mm.
the work that I've been doing with them and kind of just being nice and kind, they were able to give me some of those resources to help start at my institution. And then what was the other? What would you ask me?
What some facilitators? What's been helpful
Was it
in getting
helpful?
virtual nursing buy-in? Yeah, from seniors.
Yes. And then as far as buy-in from the staff, what we ended up doing was once we had identified who was going to be the virtual nurse, we were very thoughtful that we wanted some people to be subject matter experts. So we wanted those people to do the job every day. And those are
Mm.
the folks that we actually identified will be able to work from home, and this would be their full-time job. And then we wanted a small pool of people who would help fill in shifts that the full time people couldn't fill, but we wanted those folks to be the everyday people that work at the bedside. So, one, that gives them a little bit of a break from their everyday, hustle and bustle, but that
Mm.
also gives them some camaraderie because, like, I know these people, I work with them every day, and that helps build that trust. So, for
Mm.
the outsiders, the people that didn't know, we actually had them come on the unit. So even though it was a remote job, they had to come in on site and shadow the charge nurse for a day. We wanted them to understand a day in the life of a nurse on that unit, what it's like, who the people are, what the patients are like. And then from there, they were able to work remotely. And it actually helps because they were like, oh, yeah, I know that person. So now everyone has each other's cell phone number, they text each other. And that is the important part in building that buy in. Folks don't want to really interact with people they don't know. So you got to find a way, even from a remote perspective, to get people together and to forge those relationships.
I think you're providing some really valuable insight because so much, especially since the pandemic, so much is going in that direction in terms of virtual remote work. And even though we're talking about nursing and at a particular facility, particular industry, really these principles are across the board, especially when you talk about building those relationships, at least having that experience of putting boots on the ground and knowing, like, I see that person because I mean, look, especially if you're a nurse and all you do is talk to someone on the phone, people get kind of nasty when they don't know
Yep.
who's on the other side. But I'm so much more likely to give you a break, to be patient, to give you the benefit of the doubt when I've seen you in person, we've had lunch, or whatever the case may be. It's beyond, it's, you're not invisible anymore, right?
Right.
And so I
Exactly.
think you brought up an important point. And so you're talking about senior leadership. And so for our students who are in school or about to go to school, and you're told that you have to create a project and get buy-in, that's people saying, yes, I want to be a part of it, or yes, I'm willing to help. Those people she's calling senior leadership are also called your stakeholders. Who are
Correct.
the people who are going to benefit from what you're doing? And she brought up, what are they looking for right now? They're looking to save money, right? So her goal going into virtual nursing wasn't saving money. Her goal is to improve patient outcomes, employee satisfaction, but she
Exactly.
found a common link, and that's what you have to do. And it's not terribly difficult when you're doing this work all the time. You just have to listen to what people complain about, and people are real, they complain quite easily, so you don't
They
have to.
do. You have to try hard. I think one other piece in this too is that they also want to know, are we productive and are we doing what we set out to do? So prior to me even getting into the virtual nursing space, I talked to you that I opened up a new unit. So at the time, that unit wasn't utilizing all of the bed space that it was supposed to have, or what we originally planned for. So we had extra rooms. So we had the idea of, hey, maybe we need to open up. One thing that another hospital had in our area was a discharge lounge. So they asked me, Alicia, do you want to take this on? Let's do some research. Let's see if we can open this lounge. So we ended up doing that. I ended up developing the policy, opening up the lounge. The whole point of the lounge is when a patient gets discharged, it's a space for them to go if their ride isn't readily available. So instead of them sitting in that room, taking up that bed where we can be admitting someone else to that bed, we send them over to the lounge. There's a set of criteria that the patient could come or not come, but nonetheless, that's what the goal of the lounge was. We opened up the lounge, nobody came. And I told my senior leadership, I was like, I've been a nurse for a long time. And there's one thing I know about a nurse, they're not going to easily just give up their patients, because a patient leaving that bed means a patient's coming to that bed. And if there's one thing I know, no one's going to ask for an admission. You know, I'm going to be honest with you. This is
Yeah.
real, right? So, but my senior leadership was flabbergasted that nurses were not just going to send their patients to the lounge. I said, perhaps, maybe if we hired a nurse into that role to help bring the patients to the lounge and actually did the discharge for the nurses, maybe we would have more success. So that's what they trusted me to hire. I couldn't hire, it couldn't be a permanent role, but if I made the opportunity available for people to pick up extra shifts and serve in this role, that they would support that. So that's what we did. So we to this day, that program still goes, and I still run that program too. And nurses pick up and they literally go around to all of the medical, surgical, and intermediate care units, and they do discharges. With that being said, they asked me, well, how do we know how many discharges they're doing, who's coming to the lounge, how many people they brought? So I had to create some sort of productivity tool. And I had to show proof of concept that the nurse is valuable. Because if it wasn't, they would have said, well, why are we doing this? We don't need to do this, right? So I had an Excel document, and every day I would go in and type in all these things and da 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 da. And then sure enough, they came to me and said, Alicia, well, on average, how many nurses or how many patients are they discharging? And I was able to answer that question right away, showed proof of concept, and that's how we still have it today. So from that point, they were like, hey, Alicia, instead of having this person come in house, why don't we look at having them come in from a virtual space? And that is how I got into virtual nursing, is my work with the discharge lounge. And the goal was to transition the discharge nurse into a remote virtual nurse. So I took those same concepts and skills, though, and thoughts, is I still have to show that the virtual nurse is proof of concept and that it's a valuable resource. So what I ended up doing was taking that same thought, and I created a productivity tool for my virtual nurses. So my virtual nurses currently self-report all of the work they do, the time they start a task, the time they end a task. And then we broke this down into several categories. If they're doing an admission, a discharge, clinical care coordination, I want to know when they take their break, chart audits, technology and troubleshooting issues, and communication. So we have different categories and they self-report. I originally had it on Excel document, and then my colleagues had to. Excel is great, but it's not, the most user-friendly tool out there. So I had some other colleagues come in and get me uploaded to like the latest way of putting data out there. And that's the importance of relationships with partners, right? They're like, Alicia, why are you doing this on Excel document? There's an easier way you could do this, and let me show you and get you on board. I ended up presenting my productivity tool to the corporate group that was watching, overseeing our virtual nursing. And now my productivity tool is being utilized across all of the health system. So not just my hospital, but the entire health system. So very proud about that.
We're so proud of you, Alicia. We're so proud of you. And I love how it was like it just all happened so nicely, and you kept pulling on your previous experience with all of that. And at each phase, you weren't rushing through that journey.
No,
You
right.
enjoyed each phase of that journey, saw the value of it, but also the value that you bring. And you keep showing over and over how much your experience, you're leaning on your experience as a nurse, how that played a role. And look, and the people who maybe don't have that experience, sounds like, I really appreciate that.
Mm-hmm. Mm-hmm.
Yeah, you should be so proud of yourself. Now we know why you've won Director of the Year 2 times in a row.
Thank you. Thank you. Yes.
So you've kind of given us a little bit of a glimpse. Anything else you want to let us know about the latest in research and practice?
So there's so much out there, but one thing I want to mention is the space that AI is going to play in virtual nursing. So I mentioned a lot of things, but I think that is like phase one of all the things that virtual nursing can do. I think in a phase two, you may not necessarily even need a physical nurse to be doing some of these things. Technology will be doing a lot of those things for you. Something similar that you mentioned, Kimberly, was that there was a nurse that called you and told you about vital signs. Well, some things I've seen out there is that a computer will be telling you, hey, something was out of whack here. Or I've seen cameras with computers attached, and they're watching new to practice nurses do their assessment. And when you come back out the room, they tell you, hey, you forgot to check the pulses. You forgot to listen to the lungs. Could you imagine that as a new to practice nurse? Not having, it could be a little intimidating having your preceptor standing there, like looking at you, staring, seeing what you're doing, but having a camera and with an AI technology in the background, kind of watching you. And even when you're not new anymore, you could be seasoned. And then you come back out and they're like, that assessment, was a little inaccurate. Let's try that again. Or there was something wrong there. We should probably report that. I think that's going to change the game for patient outcomes and just nursing and medicine in general. So that's what's coming up out there.
I love that, because even in a handoff, right, when you're giving one nurse information, maybe you forgot one little piece. So when you do that assessment, the computer's like, oh, you forgot to check that drainage bag that was just placed right before change of shift. So the nurse didn't know it was there, or they just simply forgot, right? It happens.
Right.
And then you can empty it and look like, and then give you the best care to your patient.
Right. Or something that reminds you, hey, it's time to turn your patient. Or, there's different ways technology could just help enhance care. Like instead of me having to set a timer on my phone, if there was something else that, remind us to do these things, it's going to definitely enhance patient care and outcomes.
Curious though, because you mentioned on our phone, and I just think about all the like alarm fatigue. Have you seen anything out there about that, like getting so many messages when it comes to AI or virtual nursing?
I didn't hear about AI particularly, but I have heard that there are health systems who, when they talk about metrics, like for me, I haven't gotten to this point yet in my virtual nursing journey, but there are some health systems who are looking at call bell utilization and how a virtual nurse can decrease call bell burden because the virtual nurse got into the room before the patient needed anything. So they were able to even help mitigate how many times the patients were calling for questions and things that didn't require a physical nurse there. And from what I'm hearing is virtual nurses are helping drive that number down. Mm-hmm. So I think there is a space for virtual nursing and even AI to help with alarm fatigue and different, calls. And because if it's a call bell, if it's going off and someone has to physically call your phone, there's just different all sounds all the time. So yeah.
And especially for those patients, At night. Shout out night nurse. They complain too about all the noises at night because the day's so busy. They just want a peaceful night. And so those alarms bother the patients too.
Absolutely.
Even our death and dying patients, well, that'll be one of the in the order set to try to eliminate as many noises as possible.
Yeah, yeah.
And so anything else you want to say about how it can benefit healthcare entities? You did a good job talking about the numbers.
So any healthcare entity is going to look at one, the key performance indicators that I talked about, pressure injuries, urinary tract infections, things like that. But they also are going to be looking at, can we get patients out of the door quicker? So discharge times, readmission rates. They're interested in nurse retention, satisfaction. They're looking at a whole bunch of things that kind of affect the hospital as a whole and their hospital operations. So each entity is going to care about different things. So it's kind of different. It's difficult to kind of say broadly what people are interested in, but certainly any healthcare system is going to be worried about patient outcomes and certainly nurse retention and satisfaction.
Yeah, beautifully said. Before we move on to the event that you're attending, I kind of just want to hear about, I guess, how you feel about your journey so far, especially as it pertains to virtual nursing, what you've experienced so far, the fulfillment, and kind of your perspective on where you're heading with this.
I kind of talked about my journey. I started with the discharge lounge and got into virtual nursing. I can't say that I was out there seeking virtual nursing, but virtual nursing found me. And I feel like there's some divine intervention in that because, I wasn't necessarily looking, I would say in any of my nursing journey thus far, I wasn't really out there looking for it. I think that I was just doing what I thought I was supposed to be doing, and these opportunities presented themselves, and I never really said no. So I always wanted to try something new and see how I could change nursing for the better, so I've always had that as my driving course. I've always want to make nursing and nurses a better place for us. So I'm really passionate about virtual nursing because I can just see the future of how, and yes, I want this to help and benefit patients. But for me, my number one goal is for this to really benefit and help nursing, because we know we're in a space in bedside nursing where we're not going to go back to the days of having these full units of fully staffed units where, an abundance of resources. So we have to be creative and look at ways where we can alleviate some of this bedside nurse burden. And if the answer isn't going to be more body resources, we have to provide these resources in a different way to support the nurses so that they continue to come back and work and take care of our patients. Because for me, if the nurses aren't happy, the patient outcomes aren't going to be where we want them to be. So we have to invest in the nurses in order for the patients to get what they need. So that's my journey. That's my driving force. I'm always going to be a nurse advocate, and by proxy, the patients will have, better outcomes. But for me, number one, I'm always out here looking for the nurses.
I couldn't agree more. So tell us about this event that you have coming up.
So that productivity tool that I am now the corporate creator of, I'm disseminating my work to the Academy of Medical Surgical Nursing Conference that is taking place in Toronto, Ontario, Canada from September 12th to 14th. And I will be having a poster presentation on kind of the journey I just explained here and showcasing some of the data that I have curated. So
Beautiful.
I could share a little bit.
Yes,
So
please.
over 7 months, we were able to provide 666 admissions, 438 discharges, and we were able to provide more than 1,698 productive hours to return back to the bedside nurses so that they were not, that's a administrative burden that they were not having to deal with at the bedside. So we are very proud of the numbers that we've accomplished over the last 7 months. And we are showcasing that through the data that we curated from the productivity tool that I created.
That's beautiful. Have you done a survey of the nurses to know what their experience has been like?
So in phase one, we did not. And we wanted to, but reason being, virtual nursing wasn't the only thing that we were trying at that time. We were implementing remote visual monitoring, which is remote sitters, for those who don't know what that means. And we were altering the entire model of care to team nursing. So at the time, there were a lot of things going on, and we didn't create a survey. We are actually in phase 2, which we are expanding to 2 additional units, and we will actually be serving those nurses. We're actually serving them now, so I will have more satisfaction data in my second phase of data that I'm going to be reviewing. But that was one thing that in hindsight we wish we would have done. We didn't do was kind of do a pre and post survey for the nurse satisfaction piece of it and kind of get that particular part. But there was a lot going on at that time, so we definitely want to do it differently for phase 2.
And curious, those numbers you just mentioned, that's from one unit?
2.
Oh, okay. That's still very impressive, and not even 12 months.
No, nope, just for over the last, and we've been doing this for 8 months, but there has to be a cutoff point when you're viewing data. So we did 7 months of data.
And the name of the event you're attending is hosted by
the Academy of Medical Surgical Nursing. And that's actually one thing I want to articulate, is that the work that we're doing is for med-surg nurses. And I think often medical surgical nursing is forgotten, but we are important, and it is a specialty. A lot of the focus is ICU and emergency medicine, but medical surgical nursing is important and probably the most hardest hit in the nursing shortage. So that's why our hospital system decided to start with med-surg nursing with this resource, because the nurses need help and we want to figure out a way to support them. And that's why we're starting with med-surg, and I'm presenting at a med-surg conference.
We'll have to come back and talk about med-surg another time, kind of. Yeah. It's how it's talked about amongst nursing, from the older generations to the new ones, the patient, all that. It's a lot there. But what's the mission of the organization in general? How did you get involved with them?
I'm not sure of the mission. However, I'm involved with them I'm actually a certified medical surgical nurse, and this is the academy that kind of supports that certification. So, and I ended up becoming a member as well.
And so those are the last letters on the end of your name, right? Certified medical surgical registered nurse.
Yes.
And what does that mean to be certified? Did you have to take an exam?
I did. So after I was a nurse for over 2 years, and that's one of the qualifying requirements for the certification, I decided to go back and get a certification in that area. It pretty much just says that I am somewhat of an expert in medical surgical nursing. I guess the word you can use, expert.
Yes.
Knowledgeable. I can use that word, expert.
If you have almost 10 years in the game, you're certified. Okay, come on. If you're not an expert, find someone who is.
So I will say I'm somewhat of an expert in the medical surgical field, and the certification just helps to solidify that. And in some ways, it can help leverage, if you're negotiating for pay, or it provide, if you had a hiring manager that was deciding between you and another candidate, being certified in med-surg is definitely an elevator in that realm. And also, it's just good to know that there's experts in the particular field that you're working on that are around you. So we highly encourage anyone that works in this particular setting and space in nursing to get certified in it. It's not an easy test, but it's definitely not like the NCLEX. But it's definitely what you do every day. I tell people that all the time. It's what you do every single day. So don't be afraid, get certified.
Kind of like what I tell you and Geraldine about being on this show, right?
Yes. I'm not a friend of technology, believe it or not. So Kimberly is definitely a supporter of us getting it together.
And that's why this episode is so special, because this is you getting it together, which you've been doing. You're just now sharing it with the public.
Yes.
Yeah, if there's an opportunity for you to be certified in whatever specialty you work in, we highly recommend it. It shows your commitment to practice, and it also shows it helps represent standards of care and excellence, really. And in nursing, those are opportunities to continue to elevate our education. And you do have to pay for that exam, but you can usually get reimbursed from whoever you work for. So
And even the review courses, depending on who you work for, can be
Mm,
free or
wonderful.
covered by the institution. Mhm.
And that's a 5-year one, right? I
Yes.
used
So
to have that. I used to have that one.
yes, and then the renewal process actually went through that a couple years ago. Most of it is just you pay another fee, the usual, and then you have to provide proof that you did some continuing education and that you have been practicing in that field still. So even though I don't do bedside, I still am in the field, so it counts.
Oh yeah, I'm so glad you said that. Yeah, we want to make sure people know that whether you're teaching and leadership, it's still considered a practice because nurses are not just what we do at the bedside.
Exactly.
Yeah, and that comes from the American Nurses Credentialing Center, the certifications. Uh, and yeah, so this is exciting. You're going to be traveling to Canada. Have you been there before?
I have not. I'm really excited. Actually, so not next week, but the week after that, I will be in Canada. I'm excited. So we actually are going a couple days early so we can do some sightseeing and then we'll be ready for the conference.
Just your colleagues or your mom?
No, I'm going with my colleagues. So
Um,
I have a right and a left hand that kind of helped me through this process.
oh,
I
you
say
want to
like,
shout them out?
huh?
You want to shout them out? Just their
Oh,
first name?
yes, a special shout out to Tracy with an I and
Oh,
Megan. Thank you all so much for your support. Really appreciate you both. So yeah, my right and my left hand. Um, you know, I'd say like I'm the brains of the operation, but they help, bring all my crazy ideas into fruition. So
mm,
Megan helped me with the actual developing of the productivity tool. So I had the ideas, but Megan, kind of took it and ran with it. So um, she took it and ran with it. So she also helped put all of the stuff that we did at our entity to the corporate level. So she took that to
mm,
the next level. And then my girl Tracy with an I, she's actually my educator partner. So she helped me get everyone educated, develop that plan, and is helping me
mm.
with expansion. So you got to have a team. You can't do it all by yourself.
Oh, thank you. I was just about to point that because as nurses, we're put in the position a lot of times to do it by ourselves, but we don't recommend that as a sustainable practice.
Mm-hmm. Mm-hmm.
And yeah, it's true. When you have an idea, you don't have to have the whole thing. You don't have to have the idea, the plans, the money, and the time. You just have to have the vision. And
Right.
then if you're in the right place and depending on, what you believe in, God will send you those people who can help carry it out, fulfill it, make it bigger than you thought than you could have ever thought yourself, especially if you have your hands in a mini pots like we all do.
Right.
So I love that. And so you talk about disseminating your work, which for the audience, that means spreading, right? Not just keeping it amongst your friends and your colleagues, but letting the rest of the world really, because we're in a global market. And so when we look to the evidence or data research, whoever has published their research, anyone who has access to the internet can read that. So
Mm-hmm.
someone in Ghana might see Alicia's research and email her because there's always a contact and say, hey, we want to do this here. And some of her ideas, they're like, look, they're doing this over in England. Let's see if we can try it here. And so what they're doing is global, has global reach. And so you had to submit an abstract, is that
I
correct?
did. Yes.
Okay.
I submitted an abstract to the Academy of Medical Surgical Nursing, and then there was, most conferences are looking for a certain type of category of presentation. So one of their categories for this year was virtual nursing, and I said, "Oh, perfect!" So then I submitted my abstract and talked about the focus of my presentation is a productivity tool because I think that's the piece that kind of sets me apart from what other people are doing and kind of the space I want to dive into for the research. And there's not one thing that was important, I think, is you can research what other people have researched, but I think it's special to research what people haven't researched. So that's something that I wanted to do. I wanted to kind of go down a lane that no one else is going. So I want to be the expert in that. So that's the focus of our presentation. It's a productivity tool that we created.
Beautiful, beautiful. So yeah, sometimes you can read something and you're like, oh, they did all this, but they didn't talk about that. Or also at the end, they'll give ideas for the future. We
Right.
weren't able to do this, or we didn't have time, but this is what we recommend, or this is what still needs to be looked into. So again, you don't have to think of everything yourself. You don't have to reinvent the wheel. Sometimes the answer is really staring right at you.
Exactly. I'm actually also a part of the Virtual Acute Care Network, which
Hmm.
is a consortium of virtual acute care programs around the country, and actually outside the country, because there's some people in Dubai, and we meet monthly, and we literally sit and someone from a different entity presents their virtual nursing work, and we learn and we ask questions. How to do what barriers, the same questions that Kimberly is asking me, we ask each other and we learn from each other. And they're, well, what metrics are you measuring? You know, how did you get your staffing? And I actually had to present there 1 month as well. So it was nice to hear questions from my colleagues, and also praise from my colleagues in the space, to say like, wow, good work, great work, keep it up. And it's just very interesting of the spaces that I've been able to tap into with virtual nursing. So,
and it's about to blow up with this episode. Did you call it Virtual Acute Care Network?
Yes.
Okay, great. We're going to add that in the resources. And then maybe next time you'll be talking about your trip to Dubai. And you must take your mother. And then something else you just said. I was going to did you add these to your resume or your CV?
I'm adding it. Yes.
Thank you.
I'm adding it. Yes.
Anything else you want to leave with our audience?
I'd say be mindful of work-life balance, but never say no. If your heart, if it feels right and you like, I want to try something, I think just do it. I think one thing that I've found very beneficial and special in my situation is I've had leadership that's very supportive and trusted me. You know, the way that we are doing virtual nursing at my institution is unconventional. Most people that start their programs have their nurses come in-site in a room so they can have a little bit more oversight. But I said, have it work from home. If we're going to do remote, we're going to do it. And I also decided to hire in people, when most people just have their nurses come do like 4-hour shifts randomly. It's not consistent, and they have issues with staffing. Where me, I don't have any challenges with staffing. You know, I have consistent nurses every day, 7 days a week. So
wow. I would lead with that.
But I will say that I have leadership that has been supportive of me. So finding the right institution, the right leadership team, never saying no. And one thing that I learned at a conference I went to, and that has stuck with me forever, is no more pilots. When you do something as big as virtual nursing, or something that could be so beneficial, you don't want to offer this up to staff and then take it away and be like, it was just a pilot. You can learn a lot through just doing, and you are able to tweak and make adjustments. And I'd say staff and patients would be much happier for you to have implemented something and to make changes than to introduce something and then take it away. So no more pilots to those senior leaders and people listening in. Just do it. That's just like Nike said, just do it. There's nothing wrong with just doing it and making adjustments along the way. So those are my takeaways.
I love it. I definitely heard your 30-second pitch in there, your elevator pitch. So yeah, wonderful. Thank you so much, Alicia. We really can't thank you enough for spending some of your time with us to share your experience and your journey. You dropped a lot of knowledge. It's going to be inspiring to nurses who feel like they're looking for something else, right? And to give them a lot of hope and inspiration, especially because I can't say enough, just being an NP isn't the only option. And it's not the only option. And even if you've been an NP, maybe you are an NP, you don't, and you're a little burnt out, or you're looking for some more fulfillment or a different experience, there you can step into leadership. You can step into it in an organization. You can step into it as an entrepreneur. You can step into it in your professional organization, right? They all run off of the passion of volunteers. And depending on which organization, you might get paid for it. So keep that in mind. Remember, everyone, you can email us your questions or show ideas to tmi.melanin@gmail.com. If you haven't already, please subscribe to our YouTube channel. LinkedIn, and follow us on every social media platform. Say hello in the comments when you get there. And share the show with your friends. Rate us on the Apple and Spotify podcast. It lets them know that this is really important information and gets the message out there to those who need to hear it. You can find us on all of our social media platforms. Thanks to our producer, Angie. Any resource that we mentioned will be in the description box. We release new shows weekly on Sundays at noon Eastern on YouTube, LinkedIn, Instagram, soon Facebook. And then we drop the podcast, the audio at 5 a.m. for our night shifters so they can be the first to get something and not the last. And also so our day shift has something to listen to on their commute into work. We're still waiting for that email that says, hey, we watched your show during Huddle. We're looking forward to that. And any schools that are out there that want us to come and speak to your students, we would be more than delighted to do that. Follow, like, and share content with all your friends. We want to thank you for watching. Alicia, thank you for letting me be part of your journey from the beginning till now. I'm so proud. I'm so proud of you to not only watch this journey, to be part of it, and to help build up your platform and get you out there into the community. And I know your parents are equally proud. And so we thank you. We love you.
Love you too. And thanks for helping build the foundation of my journey.
Oh. We'll have to talk about that another day.
Absolutely.
Thank you, everyone, for watching. We'll see you next time.